ठीक है, अगर बहुत सीवियर आपको लगे तो केस करने की जरूरत है।
Okay. Good afternoon. Good afternoon, everyone. The topic of my presentation today is default mode network. Sir, हाँ जी sir, Aditi ma'am or Shelly ma'am is not here. So the sir ध्यान से हाँ जी sir आपके sir अलग से the topic of my presentation today is default mode network and its relevance in psychiatry, and my moderator is Mohta sir. So in this presentation, first of all, we'll be talking about the functional MRI and the other neuroimaging modalities, which has basically been the basis of the classification of these brain networks. And then we'll be going to the topic of interest, that is the default mode network and its relevance in various psychiatric conditions. So what is functional MRI or the fMRI? So we are we are all aware of the conventional MRI, the structural MRI, which is done on a day-to-day basis, and we see the anatomical and the pathological changes in the brain anatomy via this structural MRI. Now, similarly, we have the functional MRI. The functional MRI, this is also a type of non-invasive imaging modality, and there's a the patient is, it is similar to structural MRI on the basis of functioning, and it is also of two types: resting functional MRI and task-induced. So what is done here is that basically what happens here is when the patient is basically in the MRI machine, so the various visual stimuli are displayed or various sounds are played, or the patient is asked to do any motor activity. So whenever these activities are done by the patient, or the patient is asked to be just in a resting state, just focus on one point. So whenever this is done, what happens is that specific region of the brain, those specific neurons which are involved in that activity, they get activated. So when the neurons in a particular region get activated, there is more increased blood flow to that region because more energy, more oxygen is required in that brain region. So when more oxygen is required, there is more blood flow. So when there is more blood flow, more oxygen comes. So when more oxygen comes, so the oxygen delivered there is more in comparison to the oxygen which is extracted by the tissue. Now, this difference in the concentration of oxygen, which is known as BOLD, blood oxygen level dependence, or BOLD signals, this is the basis of functional MRI, and this is detected by the functional MRI. So, for example, here in this picture, we can see that supposedly when a patient was asked to perform various activities, so various regions of the brains were activated. For example, in visual activation, the occipital lobe and auditory and motor. So various other regions were activated. So this is the basis of functional MRI. It has led to the defining of other networks. Now let us come to the functional brain network. So what is a network? First of all, we have all read about the anatomical regions of the brain. We keep on reading about the Brodmann's areas and other anatomical regions of the brain. Now, whenever we have to perform any task or any activity, it is not like a single region of the brain is involved in that activity. There are multiple brain regions which are involved, and those multiple brain regions they lead to the performing us of the activity, and these regions together they form a network. So basically, a network is involved when we perform any activity. So on the basis of this, there have been 7 main functional brain networks identified. So which we'll be just going through them. So first of all, the central executive network, the salience network, and the default mode network. So default mode network, which is the topic of discussion today, this network is activated whenever we are basically it is activated when we're thinking passively. like when we're thinking about our past or about our future in autobiographical memories, self-referential thinking, when we are daydreaming, for example. So this mode is activated. Then the yes, non-attentive, non-stimulus dependent thinking. So whenever we are doing non-focused thinking, then default mode network is activated. Then the central executive network. So central executive network is activated when we are performing any active learning. For example, we're performing any mathematics, any algebra. So this, when we're taking any decision, this network is activated. Now the salience network lies in between these two. For example, when we're sitting in a class and we're thinking about something, and all of a sudden the teacher points us out. So uh, when we were thinking when we were thinking just about random things, so our default mode network was activated. When the teacher pointed us out that you have to answer to this question, the salience network, it was the salience network which basically switched us from the default mode to the central mode, that now we have to do an active thinking, we have to perform, or like we have to answer a question. So these are the three networks. The other networks are the visual network, the auditory network, and the limbic network. And the pictures below them just denote the areas, the colors denote here the areas like are presented here. Then the last one is sensory motor network. Sensory motor network is same as the sensations and the motor activity which we do. This network takes care of that. Now let us come to default mode network, also known as the autopilot mode. So the default mode network, as I just said, is active during resting conditions when there is no external stimulus. For it is involved in self-referential thinking, autobiographical memory, mind wandering, social cognition, introspection, and it is stimulus independent. Now, this default mode network is active during rest. So this is also known as task negative network. So basically, when we are performing any activity, this network gets deactivated or dampened. So that is why this is known as task negative network. And when we are performing any other activities, then our task positive networks get activated. For example, the central executive network. So we have the task positive and the task negative networks. Now, the discovery of the default mode network. So it was in 1997, first of all, by Shulman et al. This was an article. We first noted the areas in the cerebral cortex consistently having reduced activity while performing various non-self-referential tasks. Now, this finding was later confirmed by Jeffrey Binder and colleagues at the Medical College of Wisconsin in 1999. And then from there onwards, similar observations have been done on an everyday basis in various laboratories worldwide. So for example, as we can see in this picture, so these are the areas of the default mode network. So blue color denotes hypoactivity or the hypoactivity or hypoconnectivity of the network. So when it is at rest, I mean, when it is like when we are not performing any task. So this So when we are not performing any, when we are performing any task, basically, when we are doing any task, so the activity decreases of this network. And when we are thinking about ourselves or like any stimulus independent thoughts, then this gets activated, the default mode network. Yes. So basically, when we are whenever we are performing any task, so the this network is activated. Sir. I was basically activity decreases during task performance. So this activity decreases during task performance of the default mode network, and the activity increases when we are like having self-referential thoughts.
Blue color denotes less activity and this
red denotes increased activity. Now let us come to the parts of the default mode network from anterior to posterior. We'll see. So first of all, the medial prefrontal cortex. Then we basically the cingulate cortex is mainly involved in the default mode network. That to the posterior cingulate cortex. Okay, so we have the medial prefrontal cortex. Then we have the anterior cingulate cortex, posterior cingulate cortex, the precuneus, that is the superior part of the parietal lobule, and the parieto-temporal junction areas. So we'll again see. So, for example, in this picture, we can see we have the corpus callosum here, and just above the corpus callosum in the medial cortex, we have the cingulate gyrus. This whole red one is the cingulate gyrus, and the anterior part is the anterior cingulate gyrus, and the posterior part is the posterior cingulate gyrus. Now, posterior cingulate gyrus, it basically is one of the most metabolically active part of the brain. So, like cerebral blood flow and metabolic rate in the posterior cingulate cortex is approximately 40% higher than the average brain, which signifies extensive connectivity of various networks from the PCC, posterior cingulate cortex. And the other regions, here we can see the precuneus. This is the part of the this lies just above the posterior cingulate cortex in the medial cerebrum, and it depicts superior parietal lobe. Then let us come to the default mode network and its relevance in various psychiatric conditions. So first of all, schizophrenia. Now, studies suggest that there is overactivation of default mode network in schizophrenia. So there is difficulty in shifting focus away from their mental world. There are deficits in attention and working memory. There is exaggerated sense of self-reference in the world, such as paranoid ideation. Now, the DMN is over. It has also been seen that in the first degree relatives of the schizophrenia patients, there is overactivity of the default mode network. And in auditory verbal hallucinations, patients who hallucinate, they tend to be less responsive to external sounds, as shown with both EEG-based methods and fMRI methods. Auditory cortex may be less available to respond to the external sounds because it is tuned inwards to hear voices. Furthermore, patients who hallucinate have abnormally high activity in the auditory cortex during a hallucination. Next is the impact of trauma, anxiety, or depression. So trauma is basically when a person is exposed to threat to their own personal safety or to the safety of their significant other. So whenever a person experiences prolonged stress, so the hypothalamus pituitary adrenal axis, DHP axis is activated, and there is increased release of cortisol. And this increased levels of cortisol, it causes shrinkage of the hippocampus, and it increases the connectivity of the salience network to the default mode network and the amygdala also to the default mode network, this excess cortisol. So now the amygdala is hyperactive and strongly connected to the default mode network, and this basically initiates a autopilot mode or a fear-based reactive. It initiates fear-based reactive responses. The self-reference of the patient becomes of that as of being helpless or being in danger. They react in ways as per their inbuilt schemas that they're in danger. Also, as I mentioned, that the connectivity between the salience network and the default mode network also increases. Now, when the connectivity between these two increases, so the connectivity with the central executive network obviously decreases because they go like opposite. There is inverse relation between the default mode and the central executive. So when the DMN and SC, the salience network, they're connected. So this leads to reduced cognitive performance, higher levels of anxiety and negative ruminations, and inability to appreciate the current context so that prior learning is applied and reinforced. So the central executive network is not very much active here. The default mode network is more active and more connected to the salience network. Increased amygdala connectivity to the DMN in patients of anxiety leads to stimulus overgeneralization and hypervigilance. Also, major depressive disorder is characterized by reduced central executive network and salience network connectivity and stronger DMN and SCN connectivity. Now, default mode network and addiction. Now, aberrant patterns of brain functional connectivity in DMN have been observed in substance use disorder and are associated with craving and relapse. In addicted individuals, resting functional connectivity of the anterior DMN, which participates in attribution of personal value and emotional regulation. Basically the anterior DMN here is reduced, the connectivity of anterior DMN is reduced, and the posterior DMN is increased. So the anterior cingulate cortex, which basically comprises the anterior default mode network, it has basically roles in affect regulation, the emotional regulation. So this activity tends to be decreased, and the patient is more leaning towards substance addiction and intoxication. And the posterior DMN, which directs a patient to their internal world, that increases. So like the patient is always thinking about, there are ruminations in addictions, there are negative emotions. So the DMN is prominently engaged during withdrawal and preoccupation phases of addiction with an enhanced participation of the salience network. DMN prominence is decreased during intoxication phases. Now findings reveal that this resting state functional connectivity of the default mode network can also act as a potential biomarker for predicting clinical outcomes in substance use disorders. Now, DMN and autism spectrum disorder. So, autism spectrum disorder, we all know, is characterized by deficits in social communication and social interaction, non-verbal communication, self-referential processing is more, and the theory of mind. The theory of mind is basically, it refers to the ability to understand the mental states and emotions of others. So, these all aspects we know are basically are deficit in autism spectrum disorder. Now, studies have suggested that the default mode network is the main network which is affected in autism, ASD. And the majority of the functional MRI studies which have been done in autism spectrum disorders have been done in adults, because children, it is difficult to, there have been difficulties in compliance with children. And excessive head movements have also been there. So most of the studies have been done in adults, and hence there is considerable heterogeneity with respect to the age and gender and the type of task which is performed in ASD. But most of the findings, what they suggested, that there is increased connectivity between the DMN nodes. Nodes are the parts of the default mode network which we mentioned earlier, the medial prefrontal cortex, the anterior cingulate cortex, posterior cingulate cortex. So there is increased local connectivity amongst these and reduced connectivity of the DMN with other networks, so that basically the patient, the child, they are not able to switch between between the DMN and other networks, and they are not able to attend to other stimuli because there is so much connectivity in the DMN. Now, DMN and ADHD, attention deficit hyperactive disorder. We all know about ADHD. It is characterized by developmentally inappropriate levels of hyperactivity, impulsivity, and inattention. Now, one major cognitive deficit in ADHD is response inhibition, wherein an affected individual, they struggle to suppress an ongoing inappropriate response. They are not able to suppress their responses. Now it is thought, it is according to studies, there is increased default mode network activation, which is contribute to decreased task performance in ADHD, because as I mentioned that the central executive network and the default mode network, there is inverse relation. Also, it has been seen that normally there is this inverse relation, but in children of ADHD, this inverse relation is weakened. So the child is basically they are not able to suppress the default mode network whenever there is any cognitive demanding task. So there is more of default mode network activity. Also, it has been seen that putamen, we all know the part of the basal ganglia, putamen, lobus pallidus, lentiform nucleus. The putamen is involved in motor function and learning. Several studies have found negative connectivity between the putamen and DMN in healthy children. In healthy children, there is negative connection, which has shown to be attenuated or weakened in children with ADHD. So there are deficits with learning. Then default mode network and Alzheimer's disease. Now here the default mode network, it is said that it is there is hypoconnectivity. In schizophrenia, in ADHD, in autism, we saw that there was hyperconnectivity, hyperactivity, but in Alzheimer's, there is hypoactivity. The hypothesis that DMN activity during rest is necessary for memory consolidation suggests a potential connection with the development of Alzheimer's dementia. Decreased functional connectivity in the DMN of patients with Alzheimer's dementia has been consistently demonstrated, especially between the anterior and posterior regions. Changes in functional connectivity of regions within the DMN have also been found in individuals at high risk of developing Alzheimer's disease, suggesting that these changes can provide even as biomarkers for Alzheimer's disease. There is hypoconnectivity here. Then DMN as biomarkers. So, various studies have shown that the default mode network can also act as a biomarker. For example, I've cited 3 examples there from various studies. So, for example, in schizophrenia, it was seen that in schizophrenia, there was high posterior default mode network connectivity. And after treatment, it was seen that post-treatment, the default mode network activity resembled to that of healthy network functioning. Then in depression also there was similar study found that there was reduction in the functional connectivity of the DMN post treatment. In Alzheimer's disease, it was found inversely that because it was found that after treatment with donepezil or memantine, there was increased connectivity of the DMN. So this is how DMN can work as a biomarker. Now, next is a very new concept like default mode network and meditation. So we all know there are various forms of meditation, out of which two which I found like were mostly mentioned were the focused attention, FA, and the open monitoring. These two types of meditations. Focused attention is basically when sounds are played or when the person is asked to focus on breathing exercises, and then open monitoring, thinking about anything. And so it has been seen that people who meditate, they have a better control over the activity of the default mode network, and it is interpreted as increase in the brain efficiency and active control of task positive brain action. Thank you. These are my references.
What is the normal function?
Now, default mode networks normal function as in it is involved is autobiographical memory or self-referential processes. Whenever we are thinking about ourselves, our emotions, even when we're thinking about religion, about God, about love, any emotion, then the default mode network is activated.
And in theory of mind also.
In theory of mind, exactly. Yes, like ability to infer the emotions of others also.
Last to both की presentation की meditation में helps, but default mode network activity तब होता है if you're not concentrating on the task.
Increase default mode network activity maybe more calmer level. Trauma, basically, what I said here was trauma. We all know it is like when we are exposed to anything. So what happens is whenever there is prolonged stress. So when there is prolonged stress, there is increased HPA axis, hypothalamus, pituitary adrenal axis activity. There is increased levels of cortisol. Now, what cortisol does is it increases the connectivity between the amygdala and the DMN and the salience network and the DMN. So we knew that the salience network basically acts as a switch between the central executive and the default mode. Now, when there is increased connectivity of the amygdala and the salience network to the DMN, so what will happen is amygdala, is responsible for emotional processing. So there will be an autopilot mode generated because of the excess connectivity between these two, that the patient will always be in anxious state, always be feeling as if helpless or as in danger. And there is also increased connectivity between the salience and the default mode. So now the salience network is more inclined toward the default mode and not the central executive. So whenever there is the patient will not be able to perform any cognitive demanding task because he is more inclined to the default mode. So he'll be always involved in his own mind, in those negative ruminations, in those negative pain states, depressive states.
So, the parts of default mode network show can you tell about the network activity, the colors which were
Color, even I got confused in that. Okay, so the colors here show that the blue color is for hypoactivity and the red color is for more activity. So like hypoactivity, basically I think this is. Sir, I think that there's something which I've misunderstood.
Task कर तो activate नहीं.
task, like there will be hypoactivity. So when we are performing any task, so like there will be decreased activity, which is as indicated by the blue color. Hmm. Hmm. These are like functional MRI. Functional MRI. These all figures. These figures are.
This functional apparatus that work on the basis of survey or
No. It is not on the basis. Doppler works on the basis of direction of the flow of blood. It is not upon the direction of flow. It is on the basis of the change in the concentration of oxygen levels in the blood. So the bold signals it. PET scan, basically you can say it could work on the same principle. So in PET scan, exogenously we give a contrast, a radioactive substance depending upon the part of, for example in cancer, we give fluorodeoxyglucose, so that will emit positrons. Now these positrons, when they'll act on a tissue, they'll give gamma rays. So these gamma rays will be taken up. So this is PET scan. In functional MRI, we do not give any contrast. So there's a difference.
तो हमने कॉन्ट्रास्ट में तो वो एक्टिविटी कैसे क्या दिखा रही है?
So the activation of neurons in which brain region. So the bold signals, the blood oxygen, these signals are picked up by the machine.
That is one of the vaccine also.
Force is basically that is the type of contrast we use. Fluorodeoxyglucose, for example, to pick up the cancer cells. Then there are other radioactive substances which can also be used.
जितना ज्यादा जो एरिया काम कर रहा है वो तो ऑक्सीजन लेगा, ऑक्सीजन तो ब्लड से लिमिटेड ही जा रही है। तो ब्रेन ने ऐसे एवरी ब्रेन हैज दिस एबिलिटी कि जहाँ पे ज्यादा काम है वहीं पे ज्यादा दे दो ताकि वो चीज ज्यादा यूज हो। ठीक है, तो जो चीज जहाँ चाहिए वो दे दो। तो हम लोग अभी पकड़ना आ गए कहाँ पे ज्यादा यूज, जहाँ पे ज्यादा यूज हो रही है इसका मतलब वो एरिया ज्यादा काम कर रहा है, तो वो मतलब आपको वार्म दिखेगा, आपकी इम्यूनिटी करके मतलब ज्यादा ऑक्सीजन कम मिलेगा। तो ये जब हम मोटर एक्टिवेशन होगा तो मोटर एरिया में ज्यादा ऑक्सीजन प्रधानमंत्री दिखेगी, इसलिए हमें पता चल कि वो एरिया मोटर। जब हम कोई सेंसरी काम कर रहे हैं तो अब हमें यही पता चल चुका है कि जहाँ पे भी ज्यादा एक्टिविटी होगी वहां पे ज्यादा ऑक्सीजन कंसंट्रेशन होगा, वो हम पकड़ लेंगे। तो जब हमने देखा कोई सेंसरी काम कर रहा है तो कहाँ पे ज्यादा ऑक्सीजन कंज्यूम हो रही है, इससे हमें पता चल गया वो सेंसरी एरिया है। ठीक है, वो मोटर एरिया है। जब हम बिल्कुल रेस्टिंग स्टेट में बैठे हैं, जब हम कुछ एक्टिविटी नहीं कर रहे, तब हमने देखा कि कौन से कहाँ एरिया में एक्टिविटी ज्यादा हो रही है, उनको डिफॉल्ट मोड है। तो फिर ये जो डिफॉल्ट मतलब मल्टीपल यूज ना हो। कहीं मान लो कि अगर हम मतलब देख रहे हैं कि जैसे कोई पर्टिकुलर डिसऑर्डर है, एग्जांपल ऑफ कोर्स कार्डियो के लिए तो यूज होता ही है, बट एनीवे अदरवाइज आल्सो कौन से एरियाज में ज्यादा फंक्शनल एक्टिविटी या कम है एज कम्पेयर टू नॉर्मल, तो हमें पता चलता है कि इसकी जरूरत में इस एरिया से एक्टिविटी शायद कम हो सकती है, एग्जांपल को कम। It's like it is see everything in medicine is prior to normalcy. ठीक है, although मैं मैंने particularly lie detector नहीं रीड किया है, but it is very okay. We now know कि अगर कोई lie करता है तो कौन से एरियाज में नॉर्मल से ज्यादा मतलब नॉर्मल से ज्यादा एक्टिविटी होती है। तो अगर हम किसी पे फंक्शन में करते करते किसी से क्वेश्चन कर रहे हैं, तो अगर वो एक्टिवेट हो रहे हैं तो प्रैक्टिस तो भी लें। और ऑल्दो फंक्शन हमारी इज प्रीटी एडवांस वे ऑफ दिस पेपर, बट बेसिक वो है चेंजेस इन ब्लड प्रेशर, चेंजेस इन अगेन फंक्शन हमारे यूज टू बायोरिपर आल्सो डिस्कस कर रहे थे। बट फर्स्ट लाइट डिटेक्शन में हम लोग मतलब पल्स चेंजेस, टेम्परेचर चेंजेस, जीएसआर चेंजेस, इट इज स्वेटिंग, ये चेंजेस वगैरह की आफ्टर लाइट डिटेक्शन हम करते हैं, तो टेस्ट होते हैं। एक पहले वो फंक्शन हमारे से करेंगे क्योंकि अगेन दे विल रेगुलरली, अगर आप झूठ बोलते हो और हम चेक करते रहे, हमें पता है आप झूठ बोलो कि आगे कौन सी एक्टिविटी हो रहा है, तो हम उन लोगों में वो देख सकते हैं जो एक्चुअली हमें नहीं पता कि झूठ बोल नहीं बोलते। मेडिसिन इज नॉर्मल, ठीक है। अगर नॉर्मल हमें पता है कि नॉर्मल में वो नहीं होता, लेकिन लाइबल में होता, तो अगली बार देखने में जरूर मिल जाएगा। सिमिलरली बायो फीडबैक में भी बहुत ज्यादा यूज हो रहा है स्कोप में कि आपको फीडबैक देना कि देखो ये आपका ये ठीक काम करेगा, नहीं करता। What else about this? Religious first question. You mentioned about the detail about anatomical substrate of this, but there is a mention a little bit about physiological substrate. Actually, after substrate is useless, but you mentioned is in most disorders it is hyperactive.
Yes.
So with the presentation, it seems it does no role actually. It only was the problem. We want to reduce it. That's why. वो आपने meditation वाले slide का reference किया.
So that is from some article from the that is from an article from the NIH.
So in that
was
it
like-
seems that we must do meditation because we want to decrease it.
Like so it was
What is it? It is a useless thing. What is the normal physiological role of it?
so normal.
Well, for which it is necessary, it is completely unnecessary.
So it is important in memory.
आपने autobiography में बता दिया.
So autobiographical also it is like in cases of dementia we've seen there is hypoconnectivity, so it is important in memory consolidation.
Okay, हाँ,
And also sir, when we have to think like happy emotions or even angry emotions it is involved in.
one of the things which point was the problem is also कि जो ये network है ना आपका
Hmm.
structurally वो बिल्कुल limbic
Limbic
system वाला
system,
network है. तो limbic system का network बिल्कुल same है, तो at least it will play some role मतलब वो वही region आपका emotions का role play कर रहा है, वही आपका एक मतलब relaxation mode का role play कर रहा है, तो कोई role तो होगा ही होगा. Probably, but it is the usual they have a role in emotions and good emotions, but if it is pretty hyperactive, then it may
Turn out
to be counterproductive. So it has a role. And
Basically, it also helps to imagine the future too. It is hyperactive to that direction. But if you are saying it is working in theory of mind, that is, it is helping us to understand the other person's emotions. So how can the hyperactivity work in schizophrenia?
So
Because
when it is like so much hyperactive that we are not able to shift our attention to other cognitively demanding tasks, then it becomes a problem. When we are lost in our own world, for example, having schizophrenia, we are having everything is mentally.
it is not that this is about that is not to clear about the understanding so that is wanted to have the other attributes.
Yes.
But at least the amount of peaks at least the amount of it's a pretty good for the person. So कहाँ पे मतलब normal हो रहा है और कहाँ पे अभी जिस तरह normal से variant है हमें कम से कम normal लोग को दिया जाना चाहिए. Mention is on mind or they are not these two are not always not they have a brain maintenance also. मतलब brain active है लेकिन brain को maintain भी तो करना है, तो उसका भी हम लोग भी होगा. So this DMT is required the normal maintenance activity of brain. जब हम काम नहीं कर रहे हैं, making it ready to move it back into activity. ये अपने लिखते हैं अगर हम पॉजिटिव एनालिसिस देते हैं तो डीएनए becomes very better again it comes to normal.
Having education. Yes, sir. Yes, sir. It like it becomes high. So it has been seen, and that is why it's also used as a biomarker these days.
But at least it's a part of the more of the guidance actually tools to actually decrease ability to play manage scope of technology.
Before month, to see.
Then we will put department contributes for there, and I thought of
So I think